Bismillahirrahmanirrahim. Assalamu alaikum. Welcome to Let's Medicine. This is the part 2 of the osteology of the hip bone. इस वीडियो में हम जो हमारे बकाया पार्ट्स रह गए थे जैसे कि प्यूबिस एंड इस्कियम उनके बारे में डिस्कस करेंगे. First of all, coming to the pubis. So pubis is this portion of the bone over here जो कि हम यहाँ पे obturator foramen के साथ जो आपको V-shaped part नज़र आ रहा है. This is known as the pubis. It has been divided into three parts: the body, the superior ramus and the inferior ramus. The body basically serves the reason and serves the responsibility of joining these two rami to one another. The body, it has three surfaces: the anterior surface, the posterior surface also known as the pelvic surface, and the symphysial surface, that is a roughened area. This symphysial surface basically it articulates with the pubis of the other side and it gives rise to the symphysis pubis, that is a secondary cartilaginous type of joint. And the pelvic surface posteriorly जो lie करती है यहाँ पे, it is actually the anterior part of the bony pelvis and its upper part is related to the urinary bladder. It has one border, that is the pubic crust, and it has a tubercle at the anterior aspect. This is known as the pubic tubercle. Now coming towards the rami, first of all we will discuss the superior ramus. The superior ramus, it is present on the superior aspect of the obturator foramen and medially lying towards the medially lying to the acetabulum. This superior ramus, it has three borders: the obturator crust that lies between the pubic tubercle and the acetabulum. Then we have the sharp pectineal line जो कि थोड़े posteriorly lie करती है, and this pectineal line it extends from the pubic crust till the arcuate line over here. It then joins with the arcuate line of the ilium, and the third border is the inferior border over here जो कि एक sharp rounded border है, that is known as the inferior border. The three surfaces that are lying in between these borders are the pectineal surface जो कि superiorly lie करती है and it is present between the obturator crust anteriorly and the pectineal line posteriorly. The inferior border जो कि हमारे पास downward lie करता है, that is present between the obturator crust superiorly and the inferior border inferiorly. Superior ramus has three surfaces: the pectineal surface that lies between the obturator crust and the pectineal line, the inferior surface that lies between the obturator crust and the inferior border. यहाँ पे अगर आप नोटिस करें तो we have a small notch or depression. This depression is converted into a canal by the presence of the obturator membrane and the obturator muscles over here. So basically what happens कि जो superior part of the obturator foramen है, it is deficient or devoid of the membrane, जिसकी वजह से ये notch जो है ये canal में तब्दील हो जाता है and it gives the passage for the obturator nerves and vessels. And the third surface over here, this is the posterior surface that lies between the pectineal line and the inferior border here, also known as the pelvic surface. Now coming towards the inferior ramus. So the inferior ramus lies on the inferior aspect of the body of the pubis. It has two borders and two surfaces: the medial border, the lateral border, the anterior surface and the posterior surface or the pelvic surface. The lateral border of the inferior ramus is actually forming the medial part of the obturator foramen over here. And the medial border of the pubis is more prominent in the pelvises of the males. Now coming towards the ischium. So जो ischium है वो हमारे पास posteriorly lie करती है, and it is a bone that has two parts. One is the body of the ischium and the other is the ramus. The body of the ischium, it has three borders: the posterior border, the lateral border and the anterior border. And it has two ends: the upper end and the lower end. It has three surfaces: the posterior or dorsal surface, the femoral surface over here and the pelvic surface over here. This is the pelvic surface. जो posterior border of the body of ischium जो है, that is basically extending at the midway from the greater sciatic notch. Basically the posterior border of the ilium and that of the ischium, they both join together to form the greater sciatic notch. Then we have a spine over here that is known as the ischial spine, and as we go downward we have a small notch over here. This is known as the lesser sciatic notch. As you can see over here that this lower border of the ischium, it has a roughened tuberosity. This is known as the ischial tuberosity, and it is divided into two parts by a line. This upper part is the quadrilateral part and this lower is the triangular part. This is basically the posterior surface that lies behind the acetabulum. Now coming towards the femoral surface. So femoral surface जो है, that lies between the anterior border and the lateral border. Here we have the femoral surface and this is the anterior border, and posteriorly on the inward side we have the pelvic surface. This is a smooth surface over here, and it basically joins with the pelvic part of the sacropelvic surface of the ilium above here. Now coming towards the ramus of the ischium. So जो ramus है ischium का, it extends from the body, ठीक है, यहाँ से extend करता है and it goes upward and anteriorly, and then it joins with the inferior ramus of the pubis above. It has two surfaces and two borders, the upper border and the lower border. The upper border basically forms the obturator foramen lower part. The acetabulum, it is formed by all these three bones, and as we already we have discussed it earlier in the previous video as well as in this video, that the lateral 2/5 of the acetabulum, they are formed by the ischium. The anterior 1/5 of the acetabulum is formed by the pubis, and the upper or superior 2/5 of the acetabulum is formed by the ilium. So basically in the early life these three bones, they articulate with one another and a Y-shaped cartilage is formed over here, जो कि age की advancement के साथ ossify हो जाता है. So this was all about the parts of the hip bone. I hope so कि इन वीडियो से आपको थोड़ा बहुत idea ज़रूर हो गया होगा. Thank you for watching and keep watching Let's Medicine.